Welcome to Life by Design, episode 384. Welcome to Life by Design. I'm your host, Dr. Jamie Richardson. I'm joined today by my colleague, Dr. Cratio Jug.
Happy to be here, as always.
We are creators of Life by Design with many locations worldwide. Each week on the show, we discuss the principles and the practice of Life by Design. Today, we're talking specifically about osteoarthritis with the knee. So a super common condition. In fact, it affects about 15% of the population just in the United States. So you can imagine, if you extrapolate those numbers, what that's like U.S., worldwide. So it's a pretty significant impact and the effect of either a low carbohydrate diet and a low fat diet. So this great show just dives right into, exactly what, we talk about on a regular basis with Eat by Design and its effect on inflammation and healing and repair.
Yeah, I thought it was a great study, actually. Really interesting, so I thought we needed to talk about it.
Sure. Why don't you tell us about the study and we'll talk about our thoughts.
Yeah, so they wanted to look specifically at whether what you ate made an impact on, in this case specifically, it was osteoarthritis of the knee. So, they took three groups. There was a control group that ate normally. There was a group that ate low carb, and there was a group that ate low fat. And then they looked at the results, and they looked at pain scale. If I remember correctly, you have the study in front of you. They looked at pain scale, they looked at functional movement, and they also measured for
quality of life and depression.
Quality of life, depression, those were the subjective, and they also took blood samples of all
right.
in the study.
Yes.
And they were looking specifically for inflammatory markers.
Yes. Well, I think one of the initial interesting things here, if you think of the commentary, most people don't, and speaking from being a clinician, most people don't make a relationship between, definitely extremities, but, the joints of their body, if you will, or how they feel and their diet, which, this has been obviously linked for years and years and years and many, many times. But the average person who we're dealing with at the level of, our actual patients, they're still not, they're still not convinced that what they eat has a whole lot to do with what they actually feel in their bodies. Right.
And I think that's an interesting point. I think there's lots of reasons for that. I don't think that, I don't think the results are instantaneous oftentimes with food. Like, it's not like, I remember Reggie Gold, one of our mentors, saying, I wish that everyone that, smoked a cigarette would die for 15 minutes. And that way we would know that there was a direct link, right? It happens mostly at the end. So it's tough to realize that, if you're eating a diet that's high in inflammatory foods, that, according to the study, it's a high carbohydrate diet. It's not like you get sore and inflamed right after. It takes some time for these things to develop.
Yeah, people are, not tuned in to the cumulative effect of the lifestyle choices that we make. And if there's something at the fundamental core of why people are generally unhealthy, that's probably one of them, right? Is simply the fact that they don't realize, because there's no subjective change per se when they eat bad food. So if they go on a bender for a weekend, it's not as if, now for you and I, and this I think is what's interesting, the further you go down the path, in terms of the healthier you get, there's no question if I go on a bender for a weekend and eat a bunch of junk, I feel worse, not just digestively, but, my joints, my energy levels. But if that's your normal, you continue to do that, you're not necessarily going to recognize the effects of that.
Yeah, well, it's not like, throwing in one or two good meals in there is going to make that much of an impact when the inflammatory load is also really high to begin with.
Right. Yeah. It's not as if you're going to eat a salad and then, the lights are going to go off and, just magic starts to happen. I think that's where, people, they give up, right? They go, oh, well, it didn't work. And the same is true, and it's not just food. The same is true with exercise. The same is true with the chiropractic correction. All the pieces that are the blueprint of Life by Design. One of the uphill battles that we have, and why we talk about these things in the podcast in order to help people, is that you have to be able to do these things at the core level, because in principle, and there's research to suggest that they're all beneficial. They make sense. And of course, then you go ahead and it's just like testing. You get in, you go, that makes sense. That's a logical, plausible theory. Let me go in, let's test it out. But you got to have some consistency and longevity to that before you start to accumulate the effects. And the same is true in reverse.
Yep. Yeah. So the results of the study, the group that ate low carbohydrates experienced across the board in every category improvement, lower inflammatory markers. They didn't lose any weight. It's funny, they were measuring for weight, which is why the researchers concluded, that carbohydrate rich diets increase inflammation, because that was the way that they explained it. Right, it was the inflammatory markers went down, so carbohydrates are inflammatory.
Right. Well, yeah. And you're probably looking at, you'd have to tease out the data, but, what are the sources of the food in terms of, are they eating,
right?
Yeah. Like, are they eating safe starches? Are they eating, simply just sugars or other types of carbohydrates? So, that would be the kind of the next step, is to dig into this and say what types of carbohydrate. But if you go back to our template, we talk a lot about a carbohydrate appropriate diet. So I would think, if I had to hypothesize, if someone's physically active and they're consuming healthy, safe starches, along with, other well-rounded meals, protein, good fats, we're probably not going to see a big inflammatory jump. My guess is that, not only are these carbohydrate amounts higher, but they're also probably from lower quality sources.
Yeah, so the biggest problem is the sample sizes were small. So the groups were, because they were doing a lot of details. So the groups were like 8 people and 8 people. So it's hard to make any assumptions. And you're right. I don't think the study even talked about what was considered, like, they said that they said the amount of food that they were allowed to eat, but I don't think they went into the quality of the food, right? So our carbohydrate was just measured in terms of total grams, whether you choose to eat, a chocolate bar, or whether you choose to eat, potatoes, which, to me makes a big difference, but I don't think was even controlled in the study.
Yeah. Well, I think the takeaway, if you're listening and wondering, okay, well, what's the main point here? It's that, number one, what we eat, along with other lifestyle factors, they play a role in, the molecular structure of our body. They play a role at the very small physiological level. And I think that, to me, that was my big takeaway. If I was somebody who wanted to communicate to a patient, or I was a patient, it's that, okay, the food I eat actually has an effect on things that don't seem to be connected. And I think that's where, our patients in a clinical sense don't always grasp, okay, but my knee's over here and I put food in over here, how does this have to do with that? They understand the movement part. Like, I get that if my knee moves better, they also understand if I lose weight, right? Because they can get the mechanics component of it. But it's, I think, the physiological perspective that they don't fully understand. And, we've been coming back to this idea of inflammation. I think that it's been well established and beaten, in the podcast world, and definitely even now in the research sphere, which is wonderful. Carbohydrates aren't in and themselves bad, but the quality of food that we eat plays a big role. And of course, sure, if you consume too many calories at some point, that's going to be an issue. But I think the big takeaway is, once again, real food first, that our food and other lifestyle factors have an effect on the physiology of our body, even on the microscopic level, and that there's a cumulative effect of those choices, good or bad, and that you're not going to notice those changes right away. So with someone, say, with knee osteoarthritis, it gets to the point where they're severely symptomatic. They're thinking, well, I need a drug, I need a surgery. And then I'm going to try this, new lifestyle thing. I'm going to go ahead and I'm going to take shark cartilage, or I'm going to, do all these other things, hopefully make a change in their diet. But then 6 weeks in, they don't feel a change, and I need to go have surgery. And the fact is, this could take a much longer period of time than you would expect. But in the end, you could get away without having a surgery, very possibly, with reducing the amount of opioid drugs or other types of drugs. And you could have just a big potential impact on your overall lifestyle.
Yeah, the other challenge, and I think we kind of alluded to this too, is once it comes to later stages osteoarthritis, like, the joint's bad, right? There's not many options at the end of this, right? There's a lot of options at the beginning. When you don't think this is the challenge. When you don't think it's that important, it's actually the most important.
Right.
right? Like it's not,
That's a good point.
It's not, right? It's not like we're going to take an x-ray of your knee and there's no cartilage or joint space left. And it's like, well, you should try this low carb thing. We missed the boat by that point, right? If it's bone on bone, this is for people who, are just starting to notice their joints aren't moving that well, or there's some stiffness, or I get up in the morning, I'm 40 years old, I'm trying to figure this out. Mm-hmm. Now is the time to start doing that. Yeah,
it's for that group, and it's for the group who is already doing it and just doesn't even need it. But here's the reinforcement of the choice that you've made. And to kind of finish up on this thought, and then I'll throw it back to you for any final thoughts. We've talked about in the past the real benefit to this lifestyle and following this Life by Design blueprint is all the experiences and all the negative things that you'll never ever know to happen because they'll never happen. And, that becomes the challenging thing to educate people about is, I'm trying to sell you on this lifestyle because of what will never happen. And of course, there's all kinds of good things that will happen as well as an effect of that. But, most people aren't motivated by that. They're motivated by something bad happening and then fixing it versus, stopping or protecting themselves from something bad happening.
Yeah, for sure. That's always the hard part, right? Is it's this too shall pass, right? Whether it's something good that's happening in your life or something bad that's happening in your life, there's going to come a time when it turns and the opposite is going to happen. It's just a hard conversation to plant the seeds where, to continue doing something where you don't see the benefits of it right away.
Yeah. Yeah, no, exactly. So guys, if you want to check out the study, we'll put it in the show notes, but I think you got the gist of this today. Thank you guys for joining the drive to 1 million families worldwide living life by design.